Long touted as the answer to Baton Rouge's mental health crisis 4 years ago, taxpayers approved a dedicated funding stream for the Bridge Center. Tonight, it's run into money problems and is laying off employees and shutting down units. The investigative unit, Chris Nakamoto, first to break this story on our news app this morning. He spoke to the director of the facility today and has much more on the tough decisions that had to be made.
Sylvia, since the facility opened a year and a half ago, 4,000 people have come through their doors. Tonight, the director says the company that operates it has not received reimbursements from the state for patients who have Medicaid.
December 2020, a happy occasion. A cadre of parish officials gathered to cut the ribbon on a brand new facility to help those with mental illness and addictions in our parish. The facility was made possible after East Baton Rouge Parish voters approved a tax to fund it. Fast forward fewer than 2 years, and the facility has already run into major problems.
Taxpayers dedicated funding for this facility. How did you guys run into money trouble?
So I wouldn't say that or categorize that we ran into money trouble. What I would say is that we have a funding source issue. And what I mean by that is the Bridge Center for Hope is the first ever crisis receiving center in the state of Louisiana. Our license is 0001. We do not, when we opened, we did not have a funding stream other than the property tax that we have. We were always knowing that we were going to have to go to the insurers, the Medicaid, the states, to be able to help supplement those costs. And that is where our issue is starting to come into place.
Charlotte Claiborne is the executive director and says since they opened, the state has not paid them for people who have Medicaid, even though they have a policy to not turn anyone away. The WBRZ Investigative Unit learned from sources at least 15 employees were told they only have 2 weeks left there to work.
How many employees are being laid off?
That information I don't have.
You're the director.
That will be we contract with RI International, so that is a RI International question.
RI International is a third party that runs the center and employs the staff. Tonight, in addition to learning of layoffs, we've also learned a number of units inside are closing. The respite unit shut down last year due to a lack of funding, and the detoxification unit will close in 2 weeks.
Despite a dedicated funding source that taxpayers approved for the Bridge Center for Hope, sources say the state has not reimbursed the center for patients who show up without insurance or Medicaid. That forced the center to have to make some restructuring decisions. So you don't know how many employees are cut, but you sent an email to board members after we had talked this morning.
No, I sent an email to board members before.
WBRZ reached out to multiple board members about why the facility is downsizing.
Who do you answer to?
The Bridge Center for Hope board.
No one wanted to talk, but all confirmed they were left in the dark about the cuts.
Okay, so you called at 9:13 again.
Yep, that's what I have in my phone.
First learning about it this morning by an email Claiborne sent out. That email the investigative unit obtained was sent after we began asking her questions about the layoffs.
As director, what is that like to promise taxpayers that certain services are going to be available and you're leading this agency and you're having to cut them?
So as the executive director, we are still providing those services. So no services are being cut off. So the promise that you keep saying that we made, we're still keeping that promise. We promised that we will provide crisis services to our residents. We are still doing that. We told you that we were going to be able to provide detoxification services to our residents. We are doing that. If you talk about respite services, it's being done in a way that we can still provide those services.
WBRZ reached out to RI International for a response and the state to find out why reimbursements were not being made to the Bridge Center. The state got back to us a short while ago and says the Bridge Center only contracted with them in May of this year and has paid reimbursements for May and June. LDH says it's looking into this matter further. Sylvia?